Hey everyone, welcome back to the channel. Let's talk about a powerful herb that's been used for centuries in traditional medicine called ashwagandha. So let's break down what this plant is, what it can do for you, and some important things to keep in mind if you're thinking about adding it to your routine. Remember, this is not a medical advice, rather for educational purposes only. Before we dive into any further, if you're enjoying the content, and don't forget to hit the like and subscribe button and comment below with any thoughts or questions you may have. Your support helps the channel grow. What is ashwagandha? Ashwagandha is an evergreen shrub that's native to tropical and subtropical regions of Asia, Africa, and Europe. You might have heard of it before. It is called Indian ginseng or winter cherry, though it is not actually related to ginseng at all. Let's talk about what makes ashwagandha so special. It's an adaptogen. But what exactly does that mean? Well, an adaptogen is loosely defined as a compound or product that helps your body resist, adapt to, or become more resilient to various stressors, whether they're biological, physical, or chemical. So if you're feeling overwhelmed or like stress is getting the best of you, ashwagandha might be a natural option to consider. So what's ashwagandha actually good for? It's commonly used to help reduce stress, anxiety, and even insomnia. Clinical trials have shown that ashwagandha extracts can be really effective at calming the nervous system and lowering levels of anxiety. Now let's talk about safety. Most people tolerate ashwagandha pretty well, even with up to 3 months of use. However, there's not enough data on how it might affect you if you take it for months or years. So be sure to keep that in mind if you're considering it long-term use. As for side effects, they're usually mild and include things like stomach upset, loose stools, nausea, or even drowsiness. That said, there are some groups of people who should avoid ashwagandha. If you have liver disease, thyroid issues, or prostate cancer, you should steer clear of it. And if you're pregnant or breastfeeding, it's best to avoid ashwagandha altogether. Now, what is the best form of ashwagandha? Most of the clinical studies, you'll find they use KSM 66, which is a full spectrum root extract of ashwagandha. This is considered one of the best and most potent forms of the herb. If you're thinking about trying it out, most studies suggest a dose of 300 to 600 milligrams per day. It's always a good idea to start on the lower end and see how your body reacts. To sum it up, ashwagandha can be a great natural way to reduce stress and anxiety and improve sleep. Just make sure to consult your healthcare provider, especially if you have any underlying conditions. And remember, while it's generally well tolerated, always start with the right dosage and pay attention to how your body responds. Thanks for watching, and I'll see you in the next video.